Are your follicles dormant or dead? Determining whether your hair follicles are dormant or dead can be tricky without professional evaluation. But here are some key differences and signs that can help you to distinguish. Dormant hair follicles, these are ones that are still alive but not doing too much. These follicles are in the telogen resting phase or kenogen, which is the empty phase, and they may regrow hair under the right conditions. The signs of these are that they're tiny, thin, or peach fuzzy hairs that are present in the scalp. The scalp still has visible pores or the hair follicle openings, we can see them. Hair loss was sudden or stress-related, such as telogen effluvium. Improvement with treatments like minoxidil serum or foam, microneedling or PRP. And we also do the treatment polynucleotides here as well. So if you found your hair loss was sudden or stress related, well then we may be able to turn back time. So with the treatments that we do here, provided the scalp is not shiny or smooth in the affected areas, if it's shiny or smooth, it's quite likely that the follicles are dead. On the other hand, dead hair follicles, these are ones that are irreversibly damaged. Dead follicles have been replaced by scar tissue or have atrophied, and these can no longer produce hair. The signs that they're dead is that the scalp in that area is smooth and shiny and feels tight. There's no vellus hair, which is the tiny little peachy hair, or any regrowth, even after several months of maybe minoxidil treatment. The area may appear scarred, as within scarring alopecia, or lichen plantaris or frontal fibrosing alopecia. There's no response to stimulants like minoxidil or other substances like PRP or polynucleotides. And you are bald for years with no signs of any regrowth. So what can you do if you don't know whether it is dormant or dead? So I suggest that you come to us and have a tricho examination. A dermatologist can check for follicular activity as well, and sometimes a dermatologist would do a scalp biopsy, which is the most defining method to check if the follicles are still alive or if they're dead. But you need to see a dermatologist for that. As soon as you start to see your hair thinning, I suggest you start early treatments. If there's any activity, these treatments may revive your follicles. I suggest you photograph and compare photographs over time to detect any subtle regrowth. Dormant follicles will usually respond to treatment and dead ones do not. We cannot revive a dead follicle, but we can resuscitate a flagging one. And how do you stimulate dormant hair follicles? So treatments like topical minoxidil, injectables of PRP or polynucleotides aim to boost blood flow to the area and activate the follicle stem cells. The topical treatments like minoxidil or Regain increase blood flow and prolongs the anagen, which is the growth phase in your hair cycle. Caffeine-based or peppermint oil shampoos and mild stimulants might help some people, but that would be in very mild hair loss. Shampoos like Nizoral reduces inflammation and DHT that's on the scalp. I usually recommend that people use that once a week. Some people go for microneedling with exosomes. I've seen calcium online recently. Don't know much about it though. And what they do is that they use a stamper to create micro injuries and then put in the exosomes. I don't know much about it. The best results come when you combine minoxidil treatment with either PRP or polynucleotides. Some people go to low-level laser therapy, which is a red light to increase the ATP production in cells and stimulate the follicles. Some people have reported that has worked very slightly, but not amazingly. But it's another alternative, and it's a good one to have on standby as well, because everything helps. Platelet-rich plasma, which is the PRP injections that we do here, your own blood is processed to extract the growth factors and they're re-injected into the scalp. This is done in a series of 4 treatments spaced a month apart. And then the alternative is polynucleotides, which is 8 treatments. Then supplementation and your nutrition I would always advise biotin, Vit D, zinc, iron, if you're deficient, because these can weaken their hair. Omegas 3 and 6 help, and collagen or marine protein supplement may help. Our hair is dead protein, so we need to have that protein in your system in order to convert it to dead protein. Always evaluate your hair loss and do a home check by using a magnifying mirror and a bright light to check for thin or fine vellus hair, which is a good sign because that means that the follicle is still alive. It might be flagging, but it's still alive. If it's smooth and shiny patches with no hair at all, it may indicate scarring or dead follicles. If it's shiny, you're better off going for a transplant. And seek a professional evaluation, either with a dermatologist, preferably somebody with trichology experience, or a trichologist, where they can assess your scalp health and hair density in more detail than I can do by doing a scalp biopsy, especially useful if scarring alopecia is suspect. Blood test that would be required, so you need to go to your GP, would be your ferritin, which is your iron stores, not your iron, it's the iron stores. Check your Vit D, your thyroid function, your TSH, T3 and T4, and your hormone levels, especially DHT and testosterone if you're male. So anything that is deficient in your system and needs to be supplemented, well, then you need to replace it, and you can take those supplements orally. We talk about minoxidil here a lot. Minoxidil was once a blood pressure tablet and still is a blood pressure tablet, and taken to reduce blood pressure by expanding the blood vessels and helping to lower blood pressure. But they had found over the years that those who were on minoxidil blood pressure tablets were growing hair, not only in their head, but in lots of other places as well. So what they did was they took the components of minoxidil and put it into a scalp solution so that that is used topically and localized in the scalp area, in the areas that you want the hair to grow, not where you don't want it to grow. All right, I hope that helps.